Hello, my name is Scott Kennedy. I'm the Director of Marketing and Corporate Communications at Connexall. Over the past few months, our global healthcare system and frontline workers have been pushed to a near breaking point. Our nurses are at the front line of the COVID-19 pandemic. Their resiliency continues to be tested. They are heroes. As some cities transition away from a surge mode to a rebuild phase of this pandemic, we address really what is the impact to our nurses? How can we help them recover? How can we help them be prepared if a second wave comes? At the time of this recording, the CDC reported 1.39 million confirmed cases of COVID-19 in the United States and just under 84,000 deaths. New York is the epicenter of COVID-19 with over 388,000 confirmed cases and over 27,000 deaths. Today's guests join me from New York as we discuss mental health and nursing in COVID-19. First of all, I'd like to welcome Dr. Dia. Dr. Dia is a program director of nursing informatics within the IT department at one of New York's leading academic medical centers. She has a fellowship in the New York Academy of Medicine and the Academy of Nursing. Dr. Dia is the immediate chair of the Kalusugan, which means Health, Coalition, and National Advisory Committee member for research on Asian American, Native Hawaiian, and Pacific Islander health. Dr. Dia is also the president-elect of the Philippine Nurses Association of America and launched a COVID-19 task force campaign, which we'll talk about today, called Heal Our Nurses. Also joining us is Alexis Balingcongan. Alexis is the Clinical Workflow Manager at Connexall and is an experienced registered nurse with over a decade experience working in hospitals and healthcare facilities. She is skilled in inpatient acute critical care and surgical ambulatory services. Alexis obtained her master's degree in nursing informatics from the University of New York. She also has helped grow the regional anesthesia block programs during her time at Memorial Sloan Kettering Cancer Center in New York City. Dr. Dia, Alexis, thank you very much for joining us today. Dr. Dia, I'd like to pose the first question over to you. In your experience, what are some of the challenges that nursing are facing in the community today?
Thank you so much, Scott. I think the greatest challenge of our organization, and not just from a nursing community, but also overall, is the mental and well-being of our members. Majority of us have suffered tremendous loss. Particularly in our organization, I had to step up to the plate and temporarily assume the role of the president because our current president, Madeline Yu, got sick of COVID, and at the same time, she has suffered mourning when her husband also passed away. So a lot of those issues have been affecting our nursing community. From a professional and healthcare industry system perspective, a lot of our nurse leaders will have to reimagine how we could promote the safety of our nurses, particularly as we reintegrate the new normal in observing social distancing and making sure that we provide the emotional and psychosocial support that they need.
So with the rapid spread of COVID-19, what do you see as really the psychological impacts of the nurses and really the long-term implications of these impacts?
A lot of our nurses, particularly those that are on the front line, have moral distress. Some of them were coping with trying to protect themselves and their family, and at the same time dealing with the day-to-day burden of looking at their patients, taking care of their patients, and trying to differentiate how can they make their patients feel that their family is with them, especially that they are on isolation. So these perspectives in terms of post-traumatic stress syndrome and the long-term effects of this to our nurses is very important.
Alexis, is this similar to your experience as you're reaching out to your nursing colleagues and customers?
Yes, especially with the, let's say, nursing informatics community. Many of us, we're frontline workers at the bedside, elbow to elbow with our fellow colleagues. And now as we've transitioned into, let's say, the informatics spectrum of nursing, there's this overwhelming sense of grief, of guilt, right? So we would love to be at the bedside, love to be at the front line, but as an alternative, what we've been trying to do is find alternative ways to help each other. So from a technology perspective, from an informatics perspective, how can we help those frontline workers at least make their workflows, at least make their day-to-day activities just a little bit better, knowing the insurmountable amount of stress that they're going through during this time.
That's good points. Dr. Dia, just leveraging off of that point, just in terms of stress and just the emotional connectedness of the patients and what they're going through, many reports indicate that a second wave of this pandemic may come if we can't flatten the curve, if we can't practice social distancing, if we can't minimize the unnecessary situations that are happening by moving people into emergency scenarios. So if we can't flatten this curve, what are you looking at from your perspective in terms of your COVID task force chair? I'm president of the Philippine Nurses Association. Are you looking at any type of educational programs or support programs, not only to address the current pandemic, but just the mental support required to maintain the resiliency of nurses if that next wave does come?
Yes, absolutely. It's so sad that every year our organization would normally meet at a national convention where we're able to connect with each other, so to speak, and share our professional experiences and have educational programs that would support our professional careers. Unfortunately, because of COVID, we need to reimagine how are we going to be doing this type of educational activities, and at the same time really support our members who have been in the front line. So one of the things that our COVID task force have recommended is to facilitate a resiliency training for our nurses. So this way it would support their healing process in the long haul and also make them capable in dealing with the next pandemic. We have what we call in our culture as the Damayan, which is helping each other, and the Bayanihan spirit, which is really to work together as a community effort in supporting each other. So I think based on those cultural aspects, we will be incorporating those nuances that are a part of our culture and trying to promote psychosocial and group therapies that will help us in the long haul.
So definitely all in this together. And how many members within your organization?
So currently we have over 5,000 members, and just to put a context in that regard, even though there's probably over 150,000 nurses, Filipino immigrant nurses here in the United States, we need to consider that we belong to a multi-generation of healthcare providers. So for example, as I was speaking with Alexis, both her parents are nurses. And on my end, my mom is a teacher and became a nurse at the same time, while others have aunts, uncles, brothers, or sisters who are either nurses or in the medical profession. Mm-hmm. So this impacts not only us as nurses personally, but wider than that throughout our own community.
Alexis, what can we do to help? What's Connexall doing today to help address these challenges that nurses are facing?
Yeah, absolutely. It falls in line, with how we want to help everyone, whether it's, in the healthcare industry or even within our own community. I know that at least from Connexall's perspective, it's for these frontline workers, for the hospital itself, how can we help with expanding their facilities? How can we help with converting spaces for them? How can we assist with those ad hoc spaces to accommodate COVID-19 patients? And just overall expanding and improving their lines of communication, whether it's through specific applications or at least just giving them a universal view of what is happening in their space, whether it's in the unit or even hospital-wide.
Thank you. And last question over to Dr. Dia. The World Health Organization recognizes 2020 as the year of the nurse, year of the midwife, with so much fluctuation that's been happening, so much loss, but so many heroes and so much bravery. What does the future of nursing look like to you?
That's really a sad event for us, right? But I think we were so looking forward to this recognition as the year of the nurse and the year of the midwife. And news media and the government officials have shown the world the hard work that we nurses continue to struggle in dealing with the shortage of PPEs, being the family for that patient who are not able to be with their loved ones. And I think together, majority of us, all healthcare professionals, are portrayed as heroes. So if we take the pandemic story out of this context, the work that we do as nurses will continue to be the same since Florence Nightingale's time. And it is now magnified as a result of COVID-19. As we, as a professional organization, continue to engage with the Future of Nursing campaign, I hope that nurses will continue to be role models and superheroes for our young generation as we continue to do ordinary work in an extraordinary way. And as what our clinicians shared in a nursing management article, she said that this is not just the year of the nurse, it's also the year of the patient. So I hope that we continue to be that warrior and we continue to arm ourselves with the head, the heart, and the hand to continue to provide compassionate healing to our patients and the community.
Well said. Thank you very much. Thank you very much for both of you for your time, your commitment to the nursing community. At Connexall, we're very fortunate. We have nurses such as Alexis on our team, keeping us honest, and we thank you very much for Dr. Dia for your participating today. Thank you.
Thank you.